Rural America represents 80% of the landmass, but 20% of the U.S. population. It really is a unique healthcare delivery environment, one that is not just simply a small version of urban, but a culture, a place, and a people. It's something we should take pride in, and it's something that represents the best of the U.S.
A lot of rural America is seen as white, as male-dominated, as agricultural dominated, and there is so much more diversity and richness to our rural Americas, both in terms of race and ethnicity, in terms of politics, in terms of occupation, geography, you name it. If people stopped and took a moment to think about who really makes up rural America, they'd be quite surprised.
The Center on Wabanaki Healing and Recovery was a dream, was a vision that was collective. It came out of a need to serve our people in Wabanaki territory with substance use disorder. What we're seeing daily is we're seeing people heal. We're seeing people heal through the way Indigenous people heal. Connection to our land, connection to our language, connection to our culture, and yes, connection to evidence-based services as well, to be able to have a place where we can hold to our Indigenous values of responsibility, see healing happening in the moment, and what I believe create a model not just for us, but a model for lots of rural America where healing can happen in lots of different ways. I don't know where else I'd rather be.
People that live in rural communities, they want the knowledge. They're eager to hear it. They want to learn how to be better stewards of their communities. So meeting those people, that's just where my heart is. Community health workers are vital in any community because they're the ones that are living with people, they're going to church with people, they're talking with people. They are those frontline workers. So us empowering and educating community health workers how to educate their community is vital in any type of chronic disease management, in any type of cancer prevention initiatives. So the community health workers are the powerhouse for the community. I think the future can be bright now that we are embracing some of these initiatives that has been around for years.
AgriMedic was started over a decade ago, and what it does is it essentially provides our emergency responders, firefighters, EMTs, and those of like, to be prepared to respond to rural emergencies. When I talk about farms, I am talking about the large property, large family, hundreds of acres, but I'm also talking about the new, what I call micro farming, which is the professional who moves to a rural community to get a little peace of mind, has 20 plus acres. They have the same equipment regardless of the size of the farm. We close that gap of that injury and illness with the community because we introduce through AgriMedic training the emergency response professionals to engage with their community, go pre-plan that farm, no matter how small or how large, and build those pre-plans so they have a guide to help them when they do, or if they do get an emergency response in that rural community.
I mean, you have cotton farms, soybean farms, blueberry farms, hay operations, cattle operations. So it makes it very important to have this program to teach the public safety on the right techniques to rescue people.
There's always that stigma of being a member of the LGBTQ community, and especially in rural communities, and then having to disclose that information to someone that may have some type of relationship with you. That could be hazardous. It could be dangerous. In order to take care of the whole person, in order to take care of everything that you need to be comfortable with your healthcare provider and giving your healthcare provider your exact situation.
The VRHA put together the Pride of Rural Virginia initiative in an attempt to find ways to help the LGBTQ community. They organize community conversations where local rural healthcare providers are in a room with the local queer community in a rural community. And the doctors, the healthcare providers, they can talk to, here are the things we're trying to do to make care more approachable, more comprehensive, more, affirming for you. And then the members of the community got to kind of speak up and say, these are the issues I'm having. And then from that, we took a lot of the information we were learning from it and started developing a curriculum that we can then offer to these health systems. We need the help. We need someone to listen to us. We need people to understand what our needs are, and facilitating ways for that information to make it to the people who need to have that understanding and provide the care is a really cool thing to be doing.
There's just profound innovation happening on a daily basis in rural communities across the country. You see people on the front lines of rural healthcare, you see the behind-the-scenes folks, you see the great research that's being done to help move things along to further highlight access to care for rural communities. You see people just rallying for each other. We saw that clearly during the pandemic. And we see just how folks really, really have a lot of heart in these communities and how they just really are a family. Rural America, rural residents, rural communities are a family.
I am rural America.
I am rural America.
Yo soy América Rural.
I am rural America.
I am rural America.
I am rural America.
I am rural America.
Together, we're addressing the challenges of today
with the eye on the future.
We invite you to get to know rural America, the people, the programs, the promise of a healthier tomorrow.